Hi, everyone. Welcome back to Bright's Media Healthcare Talk Show, your trusted channel for healthcare tips and advice. Today, we're diving into an important topic, hypertension, also known as high blood pressure. It's one of the most common yet silent health issues affecting millions of people worldwide. Joining us is Nurse Jennifer, a registered nurse with over 12 years of experience in medical, surgical nursing, and chronic disease management. She's worked extensively with hypertensive patients and is here to share valuable insights on how to manage this condition, both with medical treatment and practical steps at home. Jennifer, thank you so much for being here.
Thank you for having me. I'm excited to be here and hopefully make hypertension a little less scary and a lot more manageable for your viewers.
Let's start with the basics. What exactly is hypertension, and why is it something we should all take seriously?
Hypertension is when the force of the blood against your artery walls is consistently too high. Normally, blood pressure should be below 120/80ths mmHg. When it goes above 130/80ths consistently, it becomes a health concern. It's often called the silent killer because it usually doesn't show symptoms until it causes serious issues like a heart attack, stroke, or kidney failure. That's why it's so important to catch and manage it early.
That's really eye-opening. Is it very common?
Extremely. Globally, about 1.3 billion people live with hypertension. It's more common in adults over 40, but we're starting to see it in younger people too, often due to lifestyle factors like diet, stress, and inactivity.
What are the warning signs, if any?
Most people don't feel anything at all, but some may experience headaches, nosebleeds, or dizziness. However, these are usually seen in very high blood pressure cases. That's why regular checkups are so important, even if you feel fine.
Once someone is diagnosed with high blood pressure, what does medical treatment usually look like?
Well, we usually start with lifestyle changes, reducing salt, increasing activity, cutting back on alcohol, and stress management. If those aren't enough, we introduce medication. Treatment is personalized, depending on how high the BP is and if there are other conditions like diabetes or heart issues.
Can you walk us through some common medications used?
Sure. There are several types. ACE inhibitors, like lisinopril, help relax blood vessels. Beta blockers, like atenolol, reduce heart rate and workload. Calcium channel blockers, like amlodipine, help the vessels relax. Diuretics, like hydrochlorothiazide, help the body get rid of excess salt and water.
Are there side effects patients should look out for?
Yes, and it's important to communicate with your doctor if they happen. Some common ones include dizziness, fatigue, cough, especially with ACE inhibitors, or frequent urination with diuretics. Adjustments can always be made if needed.
Let's talk about what patients can do at home. What lifestyle changes really make a difference?
A lot can be done. Here are the top ones. Reduce salt intake. Aim for less than 1,500 milligrams/day. Follow the DASH diet, rich in fruits, vegetables, whole grains, and low-fat dairy. Exercise regularly, even brisk walking 30 minutes a day can help. Manage stress, meditation, deep breathing, or even hobbies can help lower stress-related BP spikes. Limit alcohol and stop smoking.
What about natural remedies, like garlic, hibiscus tea, or magnesium?
Some natural remedies show promise, like garlic supplements and hibiscus tea, which may have mild BP lowering effects. Magnesium can also help if you're deficient. However, these should never replace prescribed drugs unless your doctor agrees. Think of them as supportive measures, not alternatives.
How important is home monitoring?
It's crucial. I always recommend patients invest in a good home BP monitor. Check in the morning and evening, while relaxed, not right after exercise or caffeine. Keep a log and bring it to your doctor appointments. This helps us make better decisions about your care.
You've worked with many patients. Can you share a success story of someone managing hypertension well?
Absolutely. I had a patient, a 58-year-old man, who was very resistant to lifestyle change at first. He started walking daily, switched to whole grains and veggies, reduced processed food, and took his medicine regularly. Within 3 months, his BP dropped from 160/100 to 125/80, and he felt more energetic than he had in years. It showed me, and him, that simple, consistent changes can have big results.
Wow. That's great improvement. What would be your single best piece of advice for someone newly diagnosed?
Don't panic, but take it seriously. This is a manageable condition. Take small steps, whether that's walking daily, cooking at home more, or just tracking your BP. Consistency is more powerful than perfection.
Nurse Jennifer, thank you so much for these practical and powerful insights today. This was incredibly helpful.
Thank you for having me. I hope this helps someone out there take control of their blood pressure and health.
To our viewers, hypertension doesn't have to control your life. With awareness, medical support, and the right lifestyle choices, you can take charge. If you found this video helpful, please like, comment, and subscribe to Brights Media TV. Drop any questions below, we might cover them in a future video. Thanks for watching, and stay healthy.